Hi everybody, welcome to the Health How-To channel, where we talk about some great life hacks and easy tips to achieve better health. In this video, we're talking about how to fix plantar fasciitis or heel pain. First, we'll talk about the reasons why we get plantar fasciitis, and then we'll get into 20 tips and tricks to cure heel pain for good. Please subscribe and share your best tips that you have found to be super helpful for fixing your plantar fasciitis in the comments section below. Pressing the like button will also help get this information to others too. If you have someone in your life who you want to help, please share this also. Remember that this video is purely for informational purposes and does not in any way replace any advice given by your own healthcare providers. If the exercises or information suggested aggravate your condition, please stop and ask your healthcare provider for further direction. So let's get to our topic, heel pain. Plantar fasciitis is the most common reason for heel pain. It refers to the inflammation and microtearing of the plantar fascia band of tissue that starts from the heel and attaches to the base of the toes. Its job is to support the arch of your foot and is involved in stabilizing your foot as well as springing you forward when you walk. The plantar fascia fibers also blend with the Achilles tendon. So if there's a problem with your calf, the force can translate to your plantar fascia as well. So what symptoms do we feel with plantar fasciitis? The telltale symptom tends to be sharp, piercing pain first thing in the morning or after sitting for a while when you first put your feet down on the ground. You can have pain after walking or standing for a long time, a sore, swollen spot when you touch your heel, and or a tight calf or Achilles tendon. Why do we get plantar fasciitis? The two most common reasons for sudden heel pain are, number one, poorly fitting shoes or a change of shoes, for example, going from supportive winter boots to flip-flops. And two, a sudden increase in activity. This can be from starting a new sport or even a recent vacation where you are walking a lot on cobblestones or the beach. Other reasons for plantar fasciitis include walking with a poor gait pattern, such as a duck walk, walking with the feet turned outwards from tight calves or hips or flat feet, a model walk, dropping our hips from weak gluteal or buttocks muscles, or if you consistently hit your heel hard on the floor with long strides and a hyperextended knee. Running or jumping with poor biomechanics when we walk, we first put our heel down and then roll off the foot. But when we increase our speed to run, we should be propelling ourselves off on the balls of our feet. Foot shape. If you have arches that are too flat, your feet will likely roll inwards when you walk, putting too much strain through the plantar fascia. If your arches are too high, your foot will tend to be very rigid and lack the shock absorption needed, creating a very sore heel. Jobs where you have to stand or walk a lot, like cashiers, factory, and construction workers. Sports that involve a lot of running or jumping, like soccer and basketball. Floor surfaces like concrete hospital or factory floors, having one leg shorter than the other, being overweight, or being diabetic. What happens if you ignore plantar fasciitis? The heel pain can lead to limping, which can lead to compensation with your other foot or knees, hips, and back. You become really limited in your mobility, and repeated strain of the plantar fascia can trigger bone spurs to grow. How long does plantar fasciitis last? On average, heel pain can last more than 6 months. The good news is that 90% of plantar fasciitis cases can be healed without surgery. What are the 6 steps to treating plantar fasciitis? Step 1, get rid of the inflammation with rest. Step 2, changing the factors that led to your plantar fasciitis, such as your shoes and the way you walk. Step 3, stretch out the fascia and surrounding muscles. Step 4, restore full ankle movement. Step 5, strengthen your toes, feet, calves, and hips. Step 6, return to sport by working on lower body sports drills. And the last most important step, step 7, celebrate with a pain-free happy dance. And now let's talk about 20 tips to fix plantar fasciitis. There will be at least one tip that will help fix your plantar fasciitis, and most often you'll have to try a combination of tips. Tip number 1, ice. The first step in getting rid of inflammation will be to ice your heel for 20 minutes with the leg elevated. The best time to do this is after being on your feet for a long time and at the end of the day. Number 2, heat. Heat is useful to get the circulation and healing going. Put a microwavable heating pad on the bottom of your foot for 20 minutes with your leg elevated. The best time to do this is first thing in the morning, or if you know you'll be sitting for a while. Think of it as a great excuse to binge watch your favorite shows. Number 3, do consider taking an over-the-counter anti-inflammatory if you don't have stomach, kidney, or heart conditions. Anti-inflammatories can help reduce the pain caused by inflammation. Examples include aspirin, Advil, Motrin, and Aleve. Ask your doctor or pharmacist for further guidance on how much and how long to take them for. Number 4, rest your feet. Your painful heel is trying to tell you something. This is one condition where rest is better rather than pushing yourself through the pain. As soon as you feel that your heel is getting sore, sit down or lean against something to take the pressure off your foot. Now, having said that, what would be most beneficial is to do lying or sitting exercises during that time. For example, calf stretches, the bike, and hip strengthening. Number 5, orthotics. Sometimes you can do all the exercise you like and the feet you were born with will always be very flat or highly arched. This is when custom orthotics can really help. Orthotics are molded plastic inserts that go into your shoes that are customized to put your foot into the correct alignment. Think of them like dental braces, but for your feet. Just like dental braces, they can initially hurt, but over time they're meant to lift your arches and redistribute the forces that go through your feet when you're on them. And just like braces, they should really be worn all the time to be truly effective. A healthcare professional like a podiatrist or physiotherapist will do an assessment of your postural alignment, range of motion measurements, strength, functional abilities, and then make a mold of your feet. From that mold, along with the results of the assessment, they will make an orthotic that is specific to your feet. These are called corrective orthotics because they are meant to correct the shape of your feet. Number 6, gel heel cups or gel insoles. Now, if you have medium arches or find custom orthotics are too expensive, you can also buy what are called accommodative orthotics at a drugstore or online that have gel or padding that are made to work with your existing foot shape to cushion it and make your shoe more comfortable. So rather than correcting your foot shape with hard plastic, they are adapting your shoe to your current foot shape. These off-the-rack type shoe inserts can be wonderful for diabetes and severely arthritic feet that can't tolerate hard surfaces because of poor circulation and nerve irritation. Number 7, night splints. Night splints are braces that keep your foot flexed to 90 degrees to keep your calf and Achilles stretched at night. Using night splints alone probably won't cure your plantar fasciitis, but they can be helpful for people who don't have time to stretch during the daytime. Number 8, ankle braces can sometimes help depending on the shape of your foot. If you have severely weak ankles that turn outwards, sometimes even an orthotic isn't enough. An ankle brace can straighten out your ankles and prevent your foot from pronating. Number 9, wear better fitting and supportive shoes. Choose shoes that don't pinch your toes together and have a supportive arch. Sometimes having a tiny bit of an elevated heel can help with the heel pain by compensating for a shortened calf. Obviously, this is not a green light to wear super high heels. Tip number 10, don't walk barefoot or on your toes when you're actively suffering from heel pain. Later, when you recover and your feet get stronger, you can try to start walking barefoot again. Number 11, sometimes cortisone injections are not prescribed for persistent plantar fasciitis because cortisone can sometimes weaken the tendon and increase the risk of tearing. This is especially risky for a weight-bearing area like the foot. If you do get a cortisone injection, follow your doctor's advice of staying off your feet for a couple of days afterward. Number 12, lose 10 pounds. If you are overweight, a small weight loss of 10 pounds can really help take some pressure off your feet. For some people, cutting down on portion size can do the trick. And for others, it can require a lot more effort. Your diet will be responsible for 80% of weight loss, so don't worry if you're not as active because of your heel pain. Check out some of our other videos on weight loss for more tips. Number 13, use a golf ball or ice bottle roll. Use a tennis ball or golf ball to roll out tight and tender arches and heels for a few minutes. You can also freeze a water bottle and roll it to multitask icing and massaging. Tip number 14. Morning exercises are an absolute must. Do the following 2 exercises before you even think about getting out of bed. Try to set your alarm about 5 minutes before your actual wake-up time, and then you can do your exercise without opening your eyes. A. Warm up your arch by curling the foot down with toe curls and then bringing the foot upwards while spreading out the toes. Start slowly, then speed up the repetitions 30 times. B. Trace the letters of the alphabet A to Z with your toes. Exaggerate the movement of your toes and ankles. This exercise promotes a great mind-body connection. Start with capital letters and move on to cursive writing for a challenge. Number 15, stretch your calf with a runner stretch. Make sure the back foot is straight and cross your front foot forwards to really get a good calf stretch. Number 16, strengthen your calf with heel raises. Try to keep your knees straight and go up on your toes as high as you can. Number 17, strengthen your glutes to help keep your leg in alignment and prevent your foot from caving inwards. Start with lying on your side with your hips stacked one on top of the other and raising the top leg straight up. Repeat 30 times. Number 18, stand on one leg to work the small muscles in your arch and your ankles. Try standing on one leg for 10 seconds without holding on, then move up gradually to 30 seconds. Number 19, gradually increase your steps. Try to walk a little further, but pace yourself and sit down if your heel is starting to hurt. And finally, number 20, when you're returning to sport, think about landing lightly on the balls of your feet and train your ankles by lunging in different directions. Add cross step and side step cutting as well as jogging backwards. If you have some great health tips that helped you to fix your plantar fasciitis, I'd really appreciate it if you could share them down below in the comment section so that we can all benefit in our personal journey to better health. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Also, please press that like button because it can really help get this information to those that need it. Thanks for watching, and I'll see you in the next video.